Hi everyone, my name is Josh Ovie, your host. We are here. We are on our way to Koro community when we had a brief stop at an hospital to partner with us in the medical outreach, and we met a wonderful woman who I'm about to introduce to you. She'll introduce herself, and we asked her some few questions and hear some exciting things that will give you burdens to know what God is doing and how you can be of support. So, ma, can we meet you, ma?
Okay. Ifoma Olukotun, Mrs. I'm a missionary, medical missionary. I'm a nurse midwife, and we work with Christian Missionary Foundation, a mission agency based in Ibadan. Okay, so we working here. We are reaching to the Baribas, Barutin local government, Kwara State. So we are working among the people. They are unreached. The people are predominantly Muslims and traditional worshippers. So we are working among them using medical mission as a tool to reach out to them.
Wow, that was a nice introduction. So, ma, what's the name of this community and how did you come here and how long have you been here in this community?
Okay. The name of this community is Ningurumi. As I said before, it's located in Barutin local government area of Kwara State, Nigeria. Okay, we came here in November 2020, and we started the work, that's the medical work, in March 2021, to be precise.
Ma, so can you tell us how it all started for you, the body for missions and the body for coming here, how it all started and everything that has been going on so far you've been here?
Okay. I would like to also mention that I'm working together with my husband.
Wow. You're married?
Yes, I'm married.
Wow.
He's a medical doctor, so we are together. But
Wow.
Currently, he's not available. He's on training. He has gone for a postgraduate training, further training, just to help enhance the work. Okay, it all started. Okay, personally, that's how I got into mission. It started when I was in school. When I was in nursing school, I usually go out for medical outreaches with the hospital chapel then in the University of Abuja Teaching Hospital. So we usually go out. I followed go about for outreaches in the rural areas. So gradually I started knowing about mission, started getting aware about mission, the heartbeat of God, and how God is interested in souls. And then I started getting the burdens. Then in 2016, yes, my husband was also involved when he was in medical school. He too was involved in medical outreaches. Yes. So in 2016, where he came to a field somewhere in Abuja to volunteer for 1 year after his youth service among the Basa people, Basa tribe. So I also went there to volunteer for a week or two. So that was where we met, and of course we shared the same body and the same vision. So shortly after our,
just know that's a good love story.
Okay, yeah, it's just a summary of it. So shortly after our marriage, we decided to join the mission fully. So we went through the CMF, the Christian Missionary Foundation, cross-cultural mission training for 1 year, after which we were sent here to work among the people of Bariba.
Wow, that's a good one. I think that's what God wants to see, kingdom marriages. People will go together and establish God's kingdom. Because one will chase 1,000, two will put 10,000 to flight. I want to thank God for your family. So, ma, what are the challenges in this community before coming here? and when you are here, the challenges you are facing, and the ones God have been able to help you resolve so far, and the ones you are trusting God to help you resolve.
Thank you. So before we came here, because we did a survey before coming here, but sometime in 2011, while my husband was still in medical school, according to him, he was here with a group of missionaries. He came for a medical outreach, yes, in December 2011. So that was when he saw the nature of the place, how the place was. That was when the body, he started having the body then. But this place, I'll just describe it as they are underserved, and marginalized in terms of social amenities and all of that, like hospitals or even in schools. There are no good schools around, but thank God for the mission school, because the agency, that's Christian National Foundation, also has schools here. So, but currently, or even before we came here, there was no hospital, there was no functional hospital, even though they have primary health centers around, but they are not functional. Till now, they are not functional. So, no hospitals. The people will have to travel. As if there's any for medical attention, they will have to travel, to the nearest place they can get, a health facility. Like the shortest is 1 hour, about 1 hour, but that place is even a cottage hospital. But to get to like the nearest city, Ishaki, to take them about 2 hours to access care. So there was no hospital, there were no basic amenities is lacking in this community. So when we came, we decided to start a medical work, as a tool to reach the people. In 2011, we started the clinic in a rented apartment. Yes, three rooms there. We are using 3 rooms: one for the consult, for the office, one for the theater, and one to admit patients. So we had 2 beds there. Okay, so we started. We are seeing a lot of cases. In fact, in a month, we could see as much as 800 patients.
Wow.
So people were coming, and the community was always serving more than 30 communities, because we have a lot of communities. We have the foreigners, because this place is very close to the Benin Republic, so the border is close by. So people come as far as Benin Republic, to access care, because this place is, is cheap, it's affordable. The services we treat as low as, then, when the economy was still okay. Malaria, to treat for malaria could be as low as 200 naira, 500 naira. They don't pay for consultation, they don't pay for their cards. So we just treat them, and they pay for their drugs. So we do a kind of drug revolving fund. So they just pay for their drugs. We are not after their money. All we are after is to see their souls being reached. So it's affordable, it's accessible, available. We stay there with them. We just started the building, and we stay there. So we are always around. There's a qualified doctor, there's a qualified nurse, so we attend to them. Then we reach out to them with the gospel, just as I said, which is the major aim of coming. So what we do, we have the opportunity, as we see the patients, we interact with them, we share the gospel one-on-one, and then we also have an audio Bible gospel in their language. So we have the audio gospel in Bariba language. And this, like I said, the hospital is not serving just the Baribas. We also have other tribes, the foreigners, like we have the Bialis, we have the Gurumas, we have the Fulanis for Fude, we have the Hausas, we have the Zamawas. And these Zamawas, they're from Kebbi State, some from Niger Republic. We have the Togo, the Sumbas, Burkina Faso. We have the many tribes, Yende. There are so many. So we have
and these people reached?
They are not reached.
They are largely unreached.
Very unreached.
I was made aware that they might be some places where they have not, there's no Christian, there's no Muslim, they're just
no religion at all. Many of them have not heard about Jesus. Like, they just come to the clinic and they're hearing it for the first time. They are neither Christians nor Muslims nor even traditional believers. They are just like that, neutral. So we have a lot of them. So what we do is to introduce the gospel. So once the patient comes, most times with the relations, we play the audio Bible. So every patient that comes to the hospital gets to hear the gospel and their relations. So when we also get the opportunity to share, we share. And another challenge, well, I will call it, is a major challenge we have, is a language barrier. So, but what we do is to try to learn the language. Yes. So it was one of the things we started doing when we came. So we tried to speak, to learn, especially the basics.
And so have you been able to?
Yes, at least I can speak something. I can share the gospel to some extent. So what we did was to try to put in our heads some Bible passages.
Okay.
Like John chapter 14, verse, I'm the way. Just try to get some of those things. So we can, without an interpreter, we can consult a patient very well. We can also relate the gospel to the patient. But to some extent, then we have the audio gospel playing from morning till night, played in their languages.
So, ma, where would your husband need support in, and the work here needs support? Because I know there's a lot of need here in this community, and for the work to be able to meet the people. And because I believe that there are still a lot to be done in this community. So will you be needing support?
Okay, before that, we will not deny God's faithfulness. So I will start by sharing some testimonies, what God has done so far. Like I said, when we started in a rented apartment, a 3-room apartment. Let me say 4 with the one we are staying.
Okay.
So when we started, after about a year, some months after a year, we decided to, because the place was becoming smaller. It wasn't serving the purpose. So because then we could even admit on the floor. On the floor, yes. We had to create other spaces. There was no space. So from the little proceeds we were getting there, we decided to start a hospital structure. Just started by faith. Yes, we started a hospital structure, but at some point we couldn't continue, and God raised help. There was an organization, a Christian organization, that came and helped to complete the building. We got to almost the lintel stage, but the organization came and finished it up within a year. It was completed within a year. So right now we are in the new hospital structure. So maybe we can take pictures later. So we are in the new hospital standard structure. So that's one of the things that God has done for us. Then on the area of staffing, manpower, when we started, it was just myself and my husband, just the two of us, and the work was overwhelming. We are always on ground from morning to night, and like I mentioned before, we could see as much as 800 patients in a month.
Wow.
We do surgeries. It was just the two of us. So, but with time, after a year, God brought a staff, a community health worker. He joined us. We were 3, but it was still overwhelming. So we kept trusting God. So, but right now, we have, apart from myself, we have a registered nurse. We have a registered midwife. We have 2 other community health extension workers with us. So for now, at least for now, we have we have enough hands. So that is another thing that God has done for us. Then we have also started constructing the staff quarters, where the staff can stay. So that's some of the things that God has done for us, and God has really prospered the work. I would say we have a lot of people that have believed, a lot of converts. In fact, some will even come and they will ask us to transfer the audio gospel to their phones. So we have a lot of them that have come to believe in Christ through this hospital. We have some of them that we are following up, in fact, even indigenous of the land, even though most of them are still undercover. Okay, so going to the challenges, of course, the major challenge, the number one challenge is still the challenge of few laborers. Plenty harvest, few laborers. We are still struggling with that because the work is so enormous.
Yeah.
And imagine a clinic serving more than 30 communities.
Please, can you elaborate on 30 communities?
Okay, it's more than not 30. Okay. Like I said, I mentioned earlier that there are Barutin local government is the largest local government in Kwara State in terms of landmark. It has many it has a lot. The communities has a lot of communities, and these communities are they are, let's say, occupied by these migrants. Yes, they are immigrants from other countries. All this Togo, Burkina Faso, Ghana, and all of that. So, and most of them stay in camps, like they stay in farm settlements. Yes, there are many of them out there. So they stay here. So they come when they hear there's a hospital that is affordable, and so they come. And in this kind of a place, where the rural place like this, there we have women, a lot of women, we will have children, the vulnerable groups that get pregnant, So I didn't mention our services here. We do preventive. We offer preventive services like health education. We health educate them. We are also into that. So what we try to do, we try to educate them, try to make them knowledgeable about their health. Yeah, so we go to their camps like every month.
And medical outreach.
Yes, we teach them. Even in the clinic, we hold antenatal sessions.
Okay.
We now do immunizations because one of the challenges too we've met here is these non-communicable diseases.
Yeah.
They are prevalent in this place, like measles, whooping cough, polio, mellitus, all of that. We are prevalent when we came. We usually battle measles when there's an outbreak. So we had to look for a way to start getting the vaccines, and God helped us. We were able to start securing vaccines. So every Friday we hold immunization and antenatal sessions. And people come from they come from far and near. So, and now, to the glory of God, those outbreaks like measles, this year we didn't have that outbreak like we used to have before. We just have few of the cases, but not like before. So that's another thing. We do health educations, we do maternal services like deliveries, and we do surgeries. Okay. We do a lot of services.
Man, we're talking about the challenges.
Okay.
Number one.
Challenges. As I was saying, issue of a few laborers. Like currently now, like as I mentioned, my husband, who is a resident doctor, is away for training. And the training is going to take a long while.
Wow.
So right now, there is no doctor on ground. Though he usually visits. He visits like periodically, monthly or 2 months or so he visits. So we've been trying to get a doctor that will stay, even if it's weekly or monthly. So that's one of the challenges we'll be having. We're also trusting God for nurses and other health workers. Okay, then we're trusting God for the completion of the staff quarters, as I said, that have been started, because right now this new building is partitioned in two. So the staff stay in part of it while part of it is used. So we are not using the entire hospital fully for the purpose. Then another challenge now we are trusting God for is the need of a chaplain. Okay. If I call him a pastor, whose work will just be solely on reaching out to the patient and especially following them up. Because that's also another challenge we have. When we reach out to these people with the gospel, they believe, they confess Christ. The next thing is to follow them up in their places, but we don't usually
to do your work.
Yes, and also good there. So if we can get some, we decide that we trust God for someone that will just act as that. His work is just travel to those communities and reach out to them, follow them up. Then also trusting God, of course, trusting God for some resource equipment, to equip. Even though, yes, another testimony, we have another organization that also help to equip the hospital, buy the beds.
Yeah.
We have the theater lights, theater beds. So we're also trusting God for more. Yeah. So for now.
Yeah. So I want you to end by encouraging young people who are the students, graduates, who are not fully aware of what's going on, to go into ministry. Very short, just tell them what they need to know about this and what they can do their part in this Great Commission task.
Okay. So my advice to everyone out there, every Christian, every child of God, especially the youth, is obedience. Obedience to the instruction of God and our Master Jesus Christ. The last commandment of Jesus is to go ye into the world and make disciples of all nations. And that instruction was for every believer, for every of his disciples, every of his child, to go out there. So I want to encourage us that mission work is not for a selected few, it's for every child of God. There is a role we can play. There is a lot for us to do in this mandate, in this end time harvest, and the souls are plentiful. You can start by praying. Pray for the souls of men. Pray for the people out there. Then you can go, can support, you can give, but let the burden be in your heart. It's time for us to go back to that which burdens God. Because if we go close to the heart of God, you see that mission is what is paramount in his heart. In his word, he said he does not wish any soul to perish, that he wants all men to be saved. So it's something we have to do collectively in our churches, but it's unfortunate that most churches don't even know about. Like me, before I came into mission, I never knew much about mission. It's my involvement in medical outreach that made me aware. So it's like that many people are not aware. So we can also spread the news of mission. Then you can visit. Have your leave, can visit, can spend the weekend, can spend a month, can spend a week. It will go a long way. There's a lot to do to help. You have to do it together to make sure that we finish this work. Thank you very much.
So one way you can do that is by sharing this video to other people and telling them about what is going on in and around Nigeria, within Nigeria. We're not even talking about outside Nigeria. Stay blessed. This is Joshua Ovie signing out. Thank you.
My heart desire, you are my obsession.